Breast milk is the natural food for a baby and is all that a baby needs for the first 6 months. In the past, mothers continued to breastfeed their children for several years. How is breastfeeding important for babies? The World Health Organization, Health Canada, Dietitians of Canada, and the Canadian Pediatric Society recommend breastfeeding for babies and toddlers exclusively for the first 6 months and sustained for up to 2 years or longer with appropriate complementary feeding. Breastfeeding should continue even after other foods are introduced. It promotes good health and protects children from lots of diseases. It helps their brains develop and helps with good dental development. As a baby grows, breast milk changes to meet the needs of babies. How is breastfeeding important for mothers? Breastfeeding is important for mothers because it helps the mother feel confident and relaxed. Mothers who breastfeed recover more quickly from childbirth and have a decreased risk for some types of cancers and type 2 diabetes. Breast milk is convenient, always at the right temperature and available anytime. How is breastfeeding supported in Canada? The Baby Friendly Initiative, or the BFI, is a worldwide program that protects, promotes, and supports breastfeeding. It is based on research to have the best immediate and long-term outcomes for mothers, babies, and future generations. The Baby Friendly Initiative helps women to breastfeed successfully and to continue to breastfeed longer. How can the Baby Friendly Initiative benefit mothers and babies? It ensures that mothers receive the help and information they need to breastfeed. It supports mothers to make an informed decision about infant feeding and ensures that mothers who are formula feeding are informed about how to safely prepare, feed, and store formula. Why is the Baby Friendly Initiative important? Families, mothers, and babies will receive evidence-based information and consistent support to breastfeed well. This gives the baby and mother the best start as they learn together. Healthcare providers will have the knowledge and experience to help with breastfeeding challenges. Breastfed babies get sick less often, and breastfeeding helps families save money. What does baby-friendly mean for healthcare organizations? The Baby Friendly Initiative supports both breastfeeding and formula feeding families. The Baby Friendly Initiative makes sure that all staff have the necessary education and skills to implement the 10 steps based on their role in the organization. The Baby Friendly Initiative protects families from formula advertising and prevents healthcare providers from promoting particular brands. How can healthcare organizations support the Baby Friendly Initiative? There are 10 steps to becoming baby-friendly. Healthcare organizations will work on these steps to achieve baby-friendly designation. 1. Facilities will have a breastfeeding policy that staff and volunteers are aware of to support mothers to breastfeed as long as they wish. 2. Ensure that staff get up-to-date, ongoing training to implement the breastfeeding policy and support all families. 3. Pregnant women will get information about the importance and process of breastfeeding. 4. Support all mothers to have uninterrupted skin-to-skin contact immediately after the birth of their baby for at least 1 hour until completion of the first feeding or as long as the mother wishes. 5. Help mothers to breastfeed and support them if they have difficulties. 6. Support mothers to breastfeed without giving other foods and drinks for the first 6 months unless supplements are medically needed. 7. Support mothers and babies being together both day and night while in hospital and at home. 8. Encourage cue-based feeding. All mothers will learn how to tell when their baby is hungry. Breastfeeding will be encouraged and supported for 2 years or more. 9. Support mothers to breastfeed their babies without using artificial bottle nipples or soothers. 10. Community health services and hospitals will work together to best support mothers. Mothers will also be told about mother-to-mother support programs. Healthcare organizations also need to adopt the WHO Code, part of the Baby-Friendly Initiative, which protects all families from the influence of advertising and marketing of infant formula and feeding products. The WHO Code prevents the promotion or giving of formula, bottles, or pacifiers by the organization. This includes samples or coupons for such products too. Baby-friendly designation is achieved after a formal assessment process by a BFI assessment team from the Breastfeeding Committee for Canada. What are some ways healthcare organizations can get started on their baby-friendly journey? Assemble a team that includes management, nurses, doctors, midwives, community health workers, clerical staff, community members, and mothers. Work through the Baby-Friendly Initiative 10 Steps and WHO Code Outcome Indicators for Hospitals and Community Health Services document. Remember that the Baby-Friendly Initiative supports all families. The steps do not need to be implemented in any specific order. Take it one step at a time. Start with something small and build on your successes. Celebrate your successes along the way. Connect with others and learn how they're implementing each step.